Good evening, everyone. My name is Teresa Kirk, and I will be presenting the role of the nurse leader in quality healthcare. This is part two of the project. For part one, I explored a specific quality care issue and the role of the nurse leader in its resolution. For part two, I'll be describing 2 to 3 current innovative, evidence-based recommendations for that quality issue that are new or different from what is currently in place at the organization. We'll also explain ideas about how the quality issue is responding to current interventions and also how an innovative idea would be used to improve the quality issue. And lastly, we'll describe the role of the nurse leader in assessing, monitoring, and communicating the implementation, risks, and errors of a proposed new solution. The year of 2014 was a pivotal moment for the U.S. Department of Veterans Affairs. The VA was embroiled in a scandal over massive wait times in its healthcare system, particularly at one hospital in Phoenix. The secret wait list kept out of view, for example, that patients had to wait on an average of 115 days to be seen by a primary care provider. Reports show an official investigation that revealed that as many as 40 veterans died while on the waiting list at the Phoenix hospital. The scandal at the Phoenix hospital also led to greater scrutiny of other VA-run facilities and whether they also have unacceptable wait times for patients. It put a national spotlight on some of the financial incentives the VA was using to encourage quicker and better care. As the largest integrated healthcare system in the nation, the VA has made a negative impact to veterans because of this issue. This presentation will also talk about current issues with long wait times at the Birmingham VA facility. Several veterans have lost trust in the VA healthcare system, and a substantial number of veterans have elected to utilize private sectors for healthcare. Now we will discuss how the problem is being measured. The VA's current measurement tool is called a strategic analytic for improvement in learning. The VA now reports veteran experience data for both routine and urgent care. For established patients, they use a single measure of wait time by the patient indicated date. And that date reflects the date that the veterans actually sit down and have a discussion with the clinician. That's the patient indicated date. Now, for the VA will report the wait time from when the veteran requested an appointment to the day he actually sat down with a provider. That's how that is measured. The VA will report on what veterans say about their experiences, and they'll obtain this by giving them a consumer assessment of healthcare providers and system surveys. And that survey is filled out by the veteran. It was recommended by the Institute for Healthcare Improvement for both urgent and routine care. Now, the VA also has same day services and they also have telehealth services. Same day services are something like walk in. When the veterans has a problem, they can walk into the clinic between certain hours. That's a way that you can measure the problem and you can see how many walk-ins you have on a daily basis. And also telehealth services through technology. They were able to get in touch with their providers and get some form of care through that. That's another way that urgent and routine care is being measured. Okay, now we'll get into the financial impact that this issue had on the federal government. The VA had way more patients than it could handle. The VA has seen a net gain of 700,000 unique patients in the past 2 years, including veterans from theaters in Iraq and Afghanistan. At the same time, the agency has struggled to fill 400 vacancies in its team of primary care doctors, which in 2013 totaled 5,100. The combination of staffing shortages and financial incentives to see patients quickly encouraged workers at the Phoenix VA hospital to act inappropriately, falsifying records about how quickly they were seeing patients in order to come closer to federal expectations. Now, it wasn't just Phoenix. The VA audit suggested the perverse incentives and practices were a result of national VA policies and therefore systemic. In the aftermath, Congress and the White House took several steps to reform the VA. They eliminated the perverse pay bonus incentives, expanded the VA leadership's power to discipline employees, boosted funding for staff and infrastructure, and allowed access to government subsidized private care in areas where VA facilities aren't accessible. That's an example of the community care and veterans choice that we spoke about earlier. Okay, so after the scandal broke, Congress and the Obama administration took separate steps to fix the VA healthcare system. This is the amount of financial impact that it had. The plan, Congress put in a plan. It contained three components. The plan provided $10 billion for a pilot program that reimbursed private care for veterans who live more than 40 miles from the VA facility or experience long wait times. That's the veteran choice. More funding for the VA. This plan allocated another $5 billion for the VA to hire more doctors and nurses and upgrade medical facilities, and it gave VA permission to enter into 27 major medical facility leases across the country. Okay, so and then the last third one was this plan allowed the VA secretary to quickly dismiss or demote senior executives for misconduct and poor performance, and it forbade the VA from attaching bonus payments to wait time goals. That was the more oversight and no perverse incentives. So, as a result of all of this, the long wait times, the scandal, the financial impact was over $15 billion and even more. And it caused them to take back the bonuses they were giving the hospitals to decrease the wait times because these people were actually getting bonuses to decrease the wait times to at least 14 days. So to keep that money coming in, they had to cover up and make it seem as if though they were decreasing the wait time to 14 days by just hiding it all together. And that's the unethical and substandard for quality care dealing with this issue, especially with our nation's heroes. Now we'll talk about the current plan for remediation. Okay, first we'll talk about the Veterans Choice Program. The Veterans Choice Program was one of the programs put into place by Congress, and it was for the veterans that live at least 50 miles or over away from a VA care provider, or a veteran that doesn't have access within 30 days. For example, if a veteran needed a dermatology appointment and dermatology doctors are booked up until 3 months out, then that veteran will qualify to use the Veterans Choice Program. And it was put in place to decrease the long wait times by sending them to an outside provider through VA consult. So the VA would pay for you to go to an outside provider if you use this Veterans Choice Program. Great program, but it still has its pros and cons. We'll talk about that later. Publicly posting wait times data on the website. That's another way that they were trying to remediate the problem. And I'll give you an example of how of my intake on that. If we make a mistake as an organization, instead of covering it up, we're only human. So I think we should be transparent, and I think we should let the world see, yes, we made a mistake. This is how we're fixing the problem, and we want you to watch us while we improve and overcome this problem. That's the sole reason of posting this information publicly so the world can see it. Is to be transparent, is to show the world, hey, we all make mistakes. This is how we're rectifying the problem. Watch us as we grow. Watch us as we start back getting to that, quality care, that over superb standard. So watch us as we do that. And I too agree with that posting publicly the wait time data on the web. I agree that that is a good plan for remediation, me personally. And we'll also talk about the mental health and behavioral appointments. Okay, initially they came up with a 30-day window for appointments. And I'm sorry, initially they came up with a 14-day window for all appointments. And they found that to be unrealistic. So they changed it to 30 days. However, with the behavioral health care, they changed that goal back to 14 days to get an appointment. And I also agree with that because mental illnesses are just as serious as physical illnesses. And, physical illnesses untreated still is tragic. But when you leave a mental illness untreated, not only are you putting that veteran in jeopardy, you're also putting others around them in jeopardy. So I agree with them changing the behavior and healthcare appointments to 14 days instead of the 30 days. So all of these are great plans for remediation. All of them were. Now we're moving on to two innovative ideas on the Veterans Choice Program. And I chose the Veterans Choice Program because it is an interesting program meant to be very positive and really help decrease the wait times. However, it's still a lot of improvement that needs to be put into place with this system. The first idea I came up with was the Veteran Choice Program needs to have a department in every VA facility. And the second innovative idea I came up with was jobs should not be contracted out to a third party. And I will explain. So let's start with the first one. Veteran Choice Program needs to have a department in every facility, every VA facility. The reason I say that is because the Veteran Choice Program here at the Birmingham VA has employees that are contractors that are in California. So if a veteran is living in Alabama and they need to go to a provider in Alabama, it would be wise to have employees in Alabama arranging those services, scheduling, and things of that nature. And the reason I say that is because I've had a personal experience with Veterans Choice Program where my appointment was over 3 months out, and so I qualified to use this program. So I elected to use it. It took me about a month for the Veterans Choice contractors to call me. Then when they scheduled my appointment, I went to my appointment. When I got there, the clerk had no idea about a Veterans Choice Program whatsoever. That was miscommunication. I could not go back to Birmingham in any department and say, hey, can you guys fix this? You know why? Because they didn't have a Veterans Choice Department. That place was in California, ran by contractors. Big gap in communication. So I think if we had a Veterans Choice Program department in every VA facility, and if it was the full-time employers working there, we would have easier access to Veterans Choice employees. If we had a problem, we could call the number and put in an extension instead of having to call to a different state. We can walk into the department and do a face-to-face. Face-to-face is always better than telephone. Less errors when arranging care because it's local. It's easier for a scheduling employee to fix a problem if she's dealing with a local facility that she's sending a veteran to versus a scheduling party 1,000 miles away. Even though technology is advancing, it's just easier if it's local, in my opinion. And immediate correction if any problem. Boom, you can just correct it on the spot versus having to call to California, get a representative on the line. The representative has to call the out the outsource the patient's choice wherever they went to their provider. That could take days, weeks. I've seen it happen so many times. So, and I'll tell you more about the jobs being contracted out versus to the full-time employees. Third party individuals sometimes don't understand the system as full-time employers because contractors and full-time employees, even though they may work for the same organization, full-time employees tend to know more about the organization as far as mission, values, culture. Contractors, a lot of them don't even work well according to Veterans Choice. They're not even in a veterans facility. They're in a whole nother building. They just talk on the phone and arrange appointments for veterans. It will also save the VA money if they let the full-time employees have their own department. It will let them save money, and it would also just decrease errors all over the board because contract employees they really know about organizations more than full-time employees. And that's been proven also. Contractors typically not a long-term job versus a full-time employee. So those are two innovative ideas that I came up with. So, the current intervention, the Veterans Choice Program, it is working. However, I think if you incorporate those innovative ideas that I just mentioned into it, then it will work even better. You can't lose. You can't lose if you had your own Veterans Choice Department in your own hospital. You can't lose if you had your own Veterans Choice Department with your own full-time employees. You're saving money and you're also decreasing on errors. You're decreasing wait times. You're correcting issues on the spot. They're getting quicker appointments. Everything will increase if we get our own Veterans Choice Department instead of contracting it out into a different state. The distance is just a barrier anyway, all in itself. The contracting is another barrier. Mission, values, the culture of your workplace is better known by full-time employees than it is by contractors. Working around a place where you see veterans every day, you know what to expect versus someone in a different state in a call center that never sees a veteran, never gets to get that face-to-face communication. So I'm a firm believer that, this veteran choice is a wonderful thing, but it has to have some improvement. It has to. If we want to see increase in quality care, quicker appointment times, then we need to incorporate at least incorporate these innovative ideas into it. If we only just do a pilot study, I think if we do a pilot study, we will see a tremendous improvement. And that's what I'm praying and hoping for in the future. All for the quality care and the standard that our nation's heroes deserve. Now we will discuss the role of the nurse leader. So how can a nurse leader assess, monitor, and communicate the implementation risks and errors of proposed new solutions? Okay, several ways. We'll start out by the assessing. Frequent surveys for veterans. That's a good assessment tool because you're assessing. When you assess, we gather. We gather information. When you give a survey and a veteran fills it out and turns it back into us, that's gathering information. That's a way for the nurse leader to assess information. So frequent surveys for veterans, that's a perfect way to gather information. Monitoring. How can you monitor something? Okay, nurse leaders. Daily review of scheduling for new and established patients. That's a great way for monitoring. Nurse leaders must also be familiar with the scheduling process and ensure the staff are following up with veterans by monitoring systems and reports often. So monitoring is an imperative part of the role of the nurse leader. And simply going through your daily reports, reviewing the scheduling for new and established patients, and then comparing them to the policy. Is it the parallel to the policy? Is it above policy, which is a good thing? Is it falling below policy? That's why it's important to monitor that every day so you can stay on track. You want to see your trends go upscale. You never want to see your trends slope downward. You always want to see them go up. That means that you're having a positive outcome. That means your system, whatever it is working. So that's monitoring. Okay, communicating. Communicating. How can you communicate as a nurse leader? Okay, we can have regular scheduling and wait time meetings and keep formal records. What do nurse leaders do at meetings? What do we do? We always share information. We share information. Sometimes it's nurse leaders from different departments. Sometimes it's different disciplines across the service line. But ultimately, we sharing this information. That's a formal way of communicating in the business setting, and you're all coming together for the greater good for one thing, and that's to increase the quality care for the veteran by communicating. So having regular scheduling and wait time meetings and keep performing records is a great way for communicating the implementation, risk, and errors. You can go over everything at one time. One time. Okay. And collaborating for ways to continue to improve. That's a piggyback on communication. It's collaborating with different disciplines or collaborating with different nurse managers, nurse administrators, nurse chief nurses, nurses period, just nurses all across the organization, collaborating, getting that feedback. So you share all your input, you share the risk, I share my risk, we go over the errors of this proposed new solution until we come to one common ground. And that common ground needs to be the ultimate outcome to increase the quality care for the veteran. I would like to thank you all for being so attentive. This is my first presentation, and I really enjoyed talking about this subject to you guys. God bless, and I hope everyone have a blessed night. Thank you.